Hello everyone. I hope you're all doing well. So today, this is the first day of International Week of the Deaf, waving hands. So today we are spreading across the about the sign language and the culture of the deaf community. So we would like to thank today today's topic is deaf health equity. EQUITY. So we will be explaining that in detail later on. So the interpreters would be, we have two hearing interpreters, Surbi and Manisha. So two interpreters are the hearing interpreters and one deaf interpreter. The second interpreter couldn't join the deaf interpreter today. So please be patient while you are attending the session. So we have our guest today, Dr. Purna Kushal Nagar. And her sign name is this. So she has a 20 years of experience related to the deaf research in the deaf community. And also she is the director of Deaf Health Equity Center. And she's a professor of psychology. So she is working in the psychology department, and also at the same time she is working as a special assistant to the provost research and engagement. So they do different activities in which she is working. So it's a good thing that we could have her today in our session. Can we spotlight Dr. Purna? Hello, Dr. Purna. Hello. Nice to see everyone. Thank you for joining our session today. Now you can begin. So you can remove me from spotlight. Hello. So today I'll be presenting about the deaf health equity. What does it mean? How a deaf person experience the not equal treatment as compared to the other people. I'll explain with the story. One of my staff member will explain you. So my staff member sign name is this. She's from Japan, moved to America and studying here. So we are working together and she's assisting me. Can we spotlight my staff member, please? So I'm so glad to see everyone here. My name is AII. This is my sign name. Thank you for having us here and giving us the opportunity to discuss and share our thoughts with you while also having an interactive session. So now we can remove AI from the spotlight. So in the chat box, you can ask your query, any word if you would like to. Hi, Purna. Yes. Okay, can you clarify what you were saying earlier? Yes, so if you can mention your job in the chat box, that would be better. What are you working right now? Your profession, in which profession you are, if you can send in the chat box. Okay, business, designer. Some people are not working. They have business, they are teacher. Software engineer. Or computer teacher, ISL teacher. Some have business, some are studying. So my designer. So I see that most of the deaf people are students here. So how do you feel while working for full time? Do you feel healthy, or how's your health condition right now? Or you are not feeling healthy while working? I'll just explain it in detail. So healthy health equity, it means, so we sign like this: equity. That means equal. Equity and equal both have the different meaning. So we will show you through the picture. So I would like everyone to see the picture, observe it. So the upper picture, it was related to the equality. Okay, everyone getting the same cycle, but the picture which was below. Yes, there is one person, Bhushan. If you would like to explain, just hold on. Just hold on. Can we spotlight Bhushan? Can we spotlight Bhushan, please? Can we spotlight Bhushan? Yes. Bhushan, can you explain about the picture which we just showed you? Can I begin? Yes, you can. So in the upper picture, the people were getting the same cycle, but it was not accommodating the needs of the people. Some people are with the locomotor disability. They were getting the same uh, material. But in the below picture, we can see the cycle was provided as per the need of the person, and they are accommodating their needs. That was the customized one. So Bhushan, he has explained it right. So in the upper picture, that same cycle was provided to everyone. So if a person with a locomotor disability, he can't ride the bicycle, and if a person is having a short height, he or she still can't ride the bicycle. So in the below picture, we can see that, yeah, that the customized material was provided. Let me show you the another picture now. So as you can see, this picture is talking about the equal, and the another one was not equal. So the one person is trying, and one person is having, in one picture they are having a stairs, and the another one they don't have the stairs. But a person who's having a short height still can't get the fruit, right? As compared to the other person who has a much higher height than the other person. So in this picture, you can see that we are talking about the equity in the left one. So we can see the biggest ladder was provided to the short-sighted person. But in the second picture, injustice, what would be the sign for it? So yeah, so injustice, like what we have. So the tree were managed this way that the both of the person can get it at the same. So yes, Kamari, you would like to add something?
Manisha, please unmute yourself. I muted everyone.
Okay. Would you like to share anything, Kamari? Okay. Is there anyone who would like to share about the picture? Okay, I'll show you the another picture now. So equal. So they are providing the equal facility to all the people. It's not related to the equality. It means that we are providing all of the. So in equity, something we would like to provide all of the same things, not to the everyone. Equity will something that we would be providing something customized. Like we need to inform them about their health things, and maybe we are providing them another information. A person who is not much aware, that is depending on people. That's how you can provide the equity to all the people. So there has been research where you can see that how equity works or how equality works, how we can provide equity to all the people. So we have different ways here. So what different ways we can adopt that provide the equity to all the people? I think it's tough. It's a blurred image. I know it's hard to see. Sorry. So we have different ways, but one way could be, your parents when they are looking at their children. So this goes with the adult also. I mean, it goes with the general way. So if or in the second wave, the government is changing any of the rules, regulation, maybe related to the accessibility or the interpreters. If someone has met with an accident, or how could you feel safe at your home while you having uh, good food and everything in city. So if we are not getting any of the things, maybe in rural areas or at any place, how we can provide the basic amenities to the people. So when you see some people when they are smoking and drinking a lot, and they're not doing any exercise, so that we need to advise them, we need to inform them that hey, you need to do the exercise, you need to control on yourself, don't smoke much, don't drink much. So that's how they will know, and they might change their behavior as well. But changing the behavior or their daily routine, that's how they can get better. Or if a person is sick, and person is not able to control their food habits, they need to take the medication, and they need to take help of the other person. If a person passed away, we have a different scenarios here, but here, if now I will be coming and she will be volunteering. So she is a doctor and we're also supporting the deaf community in Japan. She would be telling you in detail also how we can have the different ways for the health equity. Yes, we have a lot of things. It's a heavy topic today, but she would be talking about the education. She will be explaining in brief what people are supposed to do in Japan. That's how you can also learn and you can go ahead and do the same thing in India as well. Can you please have I here? Yes. Asking I a couple of questions. Can you have I please? Hey, I could see that Dr. Ali wants to say something. Hmm, where is Dr. Alim? Okay, I would like to ask you something. Hey, hold on. Yes, Dr. Alim here. 1 minute. We have a question for you. So before you start asking I just want to add that question and then we can go ahead. Can you sign the question for me? Yes, sure. So it's also in the chat box by Sudhamani. So she's saying with deaf health equity, what advice you would like to propose to make it more accessible in India? So as of now, two things we can propose here, like advising the deaf community so that deaf people can get the awareness. So we need to make them understand how they can take care of their health. So that's how they can go ahead and work on their health. You can collaborate with the government. Maybe you can collaborate with the hospitals, and also you can. That's how work together, and you can inform the other areas like how the health services can make accessible to the deaf community. So that is more important to have a connection with them and to discuss with them in brief. They would not be aware about the deaf community's needs. They would not know what the things deaf community actually requires. So they actually need our help to get the awareness. So we need to advise them. That's how the hearing people would get to know. First, yes, so we can advise them. That's how you can begin your work. Or for at the big level change, it will not be possible. Some people might understand, some people might not understand. So, but yeah, you need to do it for all, and it might take time in the beginning. Thank you so much. Now, I think there is Hitesh who has raised his hand and would like to ask. Okay.
Manisha, let's switch.
Okay.
Okay. So I want to know the different systems what are there in the US, and of course it's very different from India. In the US system, the people when they fall sick, or they're not doing well, something happens with them, accident happens with them, they go to the doctor, and and they have interpreter access. They have that in the US, right? And they have interpreter access, or there is video call services available where they can communicate with with the people. Whereas here in India, if I fall sick or anything happens to me and I want to visit a doctor, um, of course, like being a deaf person, we have to take some or the other hearing person with us. And um, yeah, we have to. I mean, we could like communicate using writing, etc., but they're not like interested in communicating with us via writing mode, and that becomes like a huge challenge. So what do we do in that kind of a situation? If we are bringing an interpreter, then they who's going to pay the interpreter? They, of course, they don't want to pay the interpreting service, and I as a person have to pay the interpreter. And if I'm not like calling the interpreter, then how will I communicate with the doctor? So yeah, yeah, I know it's very hard. It's extremely hard. You know, in the US also, we didn't have interpreters long back, but now, of course, the situation's better. So India definitely needs that, you know, people have to come together and advocate with the government for policy changes. And that's what needs to be done. Like policy changes need to come with the government. And the other idea is that you can train community health workers. You know, I just typed it out. So they can, the health workers themselves can go with you, and they could go with the deaf people. Yeah, I mean, that's another presentation I could take. Okay, so I have to, yeah, I know I have to switch to I now. We have 15 minutes left, so what do you want to say something? I know we've taken a few questions, but we have to take so many other questions. Murnalini, yeah. I feel very discriminated, and I feel that, you know, I have not really developed, and it's pretty hard like to progress. um, my in-laws don't let me go out, and I'm not allowed to step out of the house that much. I want to gain like awareness, etc. So can you help me with something? See, thank you for your question. We will have another presenter now, Dr. Shilpa, and she works for the other sector regarding that particular topic. So probably you can ask her that questions. Okay. Yeah. For mental health, we will be focusing on next week. So how many years have you worked in Japan as a doctor? 8 years. Okay. And in Japan, um, how many of them really know about the healthcare? Um, it's very, Manisha, can you mute people, please? It's a varied response. Some people who have been to the university, etc., they know about it, but people who have not been to universities, not have had an exposure to sign language, etc. Can you repeat that, please? So nurses at home, for old people, there were nurses at home, deaf people, and sometimes when they used to feel sick, and people who are at the beds, etc. So, or someone who would have diabetes, or high blood pressure, or someone who has had like mental health issues or a stroke, someone who can't walk after the stroke. So, and diabetes, etc. So that kind of healthcare services have been provided. And you could even you lose your vision. So your vision could be lost, and all, or blood flow to your body can be affected, and there have been really sad situations there. So there are so many people like that. Like, of course, it's not possible for you to be at every place. So what do you suggest is the best practice on how to like reduce um, all these healthcare issues which the deaf community faces, the health issues, some health issues, if you could suggest, I mean, some health tips. So two things here. One is, of course, like training, explaining them about the healthcare. That is really time consuming. It takes a lot of time. And second is with the government, like we could speak to the government and get the fundings, and we could work in that area, like curate videos, content videos related to healthcare, cancer, and how we can find out what's the causes and what the symptoms are. Therapy, medical, um, medicines, operations, different things, that how they are used, if we can explain that. There could be videos explaining all of that. If those videos are available, people can really see them and understand in depth about how cancer happens, how different things happen. Do you have a website that you can show? Yes, sure, I will. Okay. I need permission to share the screen. Can someone give me the permission? Okay, now I have it. Thank you. So how much funding, I mean, how much time? I know it's funding is a lot. It's how many months did you take to, make these videos? It's total 50 minutes are worth of content. Videos, it took 2 days to curate the videos, but a lot of planning, a lot of preparation. We had to read a lot of material on how we would be signing this correctly, and how pictures will be placed, how it will be suitable for the community. So all of it nearly took 1 year. Adding subtitles, editing, all of it totally. Yeah. How many people were working with you for this? So we had the grant from the department, and deaf people came together and started working. Deaf doctors, medical experts, interpreters, and a team of people together on how this translation work would go. And video editors, people who knew sign language and could also work with pictures and videos. It was a lot of people, a lot of hard work, like that. I think around 10 people. Thank you. Over to Dr. Alim. So I'm going to be signing in ASL. I think even when COVID happened here in India also, a lot of information was made accessible. Of course, that was not available for deaf people, and how to find information about the vaccination, about masks. Luckily, we got a grant, and there's this one deaf woman who's a lawyer now, and she got a grant and support from D Law, and it was a small grant for curating content and awareness videos about COVID. So I will show you a picture, and I think is that something that you mean about health equity? Allow me to share screen, please. I need permission to share screen. Can have it. So this is the visual that was created, and we still have the videos, and we showed it to the doctors, like this poster. So this was a really good initiative that was started, like to bring in communication, and just one example. And we definitely need more of these. So this center is just starting to train people, the community health workers now, and they're also picking up like different topics related to health, screening, advocacy, interpreting, and we could ask them for grant for India. It's National Health Institute in Bangalore. They should have the funds, and you can get in touch with them, and probably they can help you with some grant. Get that grant, and then I can come and train you guys, you people, to become like community health workers. I think that's better than the pictures and the posters or videos. It's good, it's good, of course it's good, but there's just one way to look at it. But to have an interaction, you need community health workers. Dr. Alam, how much time do we have? Yeah, we do have some time. Please go ahead. Yeah. Any questions? Someone has typed out questions. Would you want me to take those? Damini, would you like to come? Let's spotlight you. So I wanted to hi, thank you. Thank you for the opportunity. And yeah, Dr. Alan was just told you that, right? I worked on that particular thing about COVID. So what I want to ask is that we need to begin with the glossary of words, and then medical related glossary, and then we can have the videos. Or should we just start with the videos directly, like without having a glossary? What do you suggest better, the process wise? See, glossary, it's not really required. I would recommend that just follow, um, whatever guidelines that are there, the rules that are there, and explain chronoscopy. Chronoscopy. Thanks. For example, if you're explaining colonoscopy, vocabulary is not going to help. So better is to explain what is the procedure and what it looks like. uh, Not all children, age group will go for it. People above 50 are going to get colonoscopy done than just going for a vocabulary. Yeah. So it depends who you are who's going to get treatment done, etc. Thank you. Yeah. Thanks. Any other question? Can I add something, Purna? Yes, I. So I think vocabulary is important as well, because people who can't like read words, who don't understand what's the meaning of words, for them it's, I mean, it's, if the media is ready for them to really understand what the concept looks like, so it helps. Yeah, of course, don't get away with the vocabulary and the process both. Yeah, I agree. Yeah, all Dr. Alim. I think this is one more question, but before that I would want to like have a poll. Let's take a question. I forgot to take it in the beginning, but I do see there's a poll. So let's go ahead with the poll first. Poll, please. I know we have to do it in the beginning, but we'll still do it. Do you know, do you understand what is deaf health equity? Yes or no? These are the answers to the poll. People are still answering. So 60% people have said that they understand what that is, what deaf health equity is, and 40% have said that they don't really understand what that is. That's fine. Next question. Next question, please. Next poll, please. Do you want to learn more about deaf health equity? Yes, no, maybe. So 86% people said that yes, they want to learn more about deaf health equity, and 6% people said that no, and 8% people said maybe. Thank you. So now I will just ask Purna and I to come back.
Should we switch?
Okay.
So we have Indrajit. He has a question. So I know about the health thing. I also facing health issues. There is some internet issue from Indrajit's side. Hope you can see me now. You can try again. I'm sorry that we couldn't understand what you're saying. So, whenever I have health issues, our next person. Yes, Lokesh, you have a question? Okay, maybe we can move to the Bhushan now. So, what is the deaf health equity means? Can you please explain in detail? Deaf health equity. That equity word I understood, but how it is related to the deaf community? Can you explain that? So, health equity, what does it mean? Like when you eat or when you have to take medication or drinking water, right? So in everything we need to have a equity, right? We need to get the access, whether it's a hearing person, whether it's a deaf person or the other person with disabilities. But we are focusing on the deaf community because they are not getting the equity. When we talk about the hearing people and the deaf person, like both are male and both are have the obese problem, both are 50 years old. Now when they are visiting to the doctor and asking and talking about their doubts, but the deaf person can't communicate with the doctor, right? So that is not the equity, correct? The health equity for a deaf person. So we are thinking that both are male, both have the obese problem, and but they think that deafness is a problem, so that is something they don't feel that they both are equal. So they need to provide the interpreter, they need to treat the deaf person at par with the hearing person. Can we have Bholi now? Thank you so much for sharing, for presenting here. So when like we have a books, right? Like we have a LKG's book where we see the alphabets. That book can be provided to our doctors and in the hospitals, in the railway station, the police station, so that the other hearing person see the signs. We, being a deaf person, we are not able to communicate and we face challenges. So, for example, if we are getting X-ray, the brain, and if we are visiting the doctor, we don't know how. I mean, family don't explain to us in detail, and also the doctors are not they do not have the knowledge of the sign language. So also if we have any stone problem in kidney or we have back pain or any of the body pain, so we did not get the information. So there is some screen showing on the Dr. Alim. Can we spotlight Dr. Alim? Yes, so what was your question, Willie? So I think it's more important to provide the ISL books to the hearing people in the hospitals and the railway stations so that they can learn a basic signs and hearing people can communicate with us. So then we will feel thankful towards them. So ISL books should be provided to them. What's your thoughts if you can share with me? Okay, thank you for informing us. Now can we have Salman? Can we have Salman now? Okay, I think his video is frozen. Okay, Vishnu, we missed Vishnu. Okay, yes, Vishnu is here. Yes, thank you. Hope you can see me. Nice to see you. So in 2019, no, Deepak, it's 2000. You are signing ASL. It's 2013, 2018. So I was with my friends. I was studying in the university. So we went to the hospital, and my friend, he was having some skin issue. So the doctor, we were not aware about that particular name of that disease, and doctor were not providing us the accessibility. So doctor asked us that all are the deaf people, and he showed us the picture on the uh, Google, and we asked him that this is the thing what is happening. So he told us that your university is not hygienic, and you where the place is not hygienic. So if you will not have the hygienic place, so then and you might face this difficulty. And also they asked us for the payment. So we told them that is I think we should not be charged here. But when we are paying and to the doctor, and later on that person had more of that disease. Doctor told we asked the doctor, but we didn't get what actually that problem happened to my friend. That was my friend was still suffering from that disease. Yes, Dr. Allen. So I had to ask you, the interpreter, in the hospitals or in the doctors, you in the nurse, if they will understand, they don't understand the sign language, and they don't know how to communicate with the deaf people. But we do have RPWD Act, we do have a law that say that we need to provide the interpreters to the deaf community, and we need to provide the accessibility to them. So you have to work with National Association of the Deaf or AIFT, All India Federation of the Deaf, so that they can do the advocacy work and they can ask for the accessibility. Yeah, it will take a long time. I know it's a big problem, but yeah, we need to do the advocacy work. So we have only 400 sign language interpreters, and much more deaf community. So we need to talk to the doctors and the nurse how they can understand. We need to train them, right? We need to consult them. That's how we would get the accessibility in the accessibility in the future. Yes, so I saying in my idea, the nurse and the and the doctor, we can provide the policies and the rules and regulations to them. So that's how they will get to know. So we need to show to the doctor. The person is signing and asking to the deaf, I mean, telling the deaf person that, doctor is speaking to the deaf patient that you need to take a deep breath 2 times, 3 times, and you need to inhale, exhale. So we can provide some other ways to the doctor that how we can have the accessible services to the deaf patients by having the interpreter. So we can provide, we can tell them that this is the screen on which we will be having a interpreter, and that's how we can have the accessible service. I think we need to wrap up now, but thank you for your time. I know this is a new topic for a lot of participants here today. I know it's but more important for the deaf community. I hope that we will have such sessions in the future. We will have the funds, and we will share more. You will share more ideas with the deaf community about the equity in India. So hope next time we will have such workshops. We can connect with you. Maybe you can show more examples. Sure, I would love to come to India. Maybe you can come to India, or yeah, that would be a good idea. I know that yeah, all the people would like to get the access in the hospital. So, but thank you once again for giving your time. Thank you everyone for coming here and joining the session. Thank you to the interpreters. Thank you so much. Bye bye.